All right. So the mayor actually just issued about the Kent quarantine. That one is, I believe it's in an Econo Lodge located in Kent. I just want to read this really fast. It says, urgent message from the mayor. I wanted to make you aware a patient at the King County Government Coronavirus Quarantine Facility located in Kent has left the facility. The patient entered a local business, stole products from the business, and then boarded a King County Metro bus heading north. The patient was awaiting test results, so we do not know if the patient has the virus or not. I have advised the county of this situation, and they have assured me that they are making a plan to address it. My fears for this facility have come true. The things I predicted would happen now have happened. We realize we have a role to play in this crisis, but we asked repeatedly for actual and patients at the facility. So that's, I'm not surprised. That is one of the fears of not well planned out. I'm not saying to lock people in, but you need to have the ability to address folks that maybe have some mental health issues, underlying issues besides this illness. Somebody that, I don't know, maybe I've been told now that it was a donut that was stolen. So that leads me to believe that this person maybe wasn't being fed. Who knows what the answer to that is? The fact is that this happened and it could have been prevented. So what's going to happen now here in White Center, and what's going to continue to happen at any and all of these quarantine sites, and why are these communities being used as a test to see how to fix problems that could have been prevented in the first place? So I want to go over the letter that was provided by Calli Knight from Dow Constantine's office. And I want to address all the things in here that I find to be completely disastrous going forward. This letter, I'm going to try to post a link to get this letter as well. Let's see. So I'm just going to get to the points that really matter right now. Says the criteria as we know it, and this is for the quarantine sites. Proper ventilation. Each room has a separate HVAC. Multi-unit dwelling, space to accommodate modular housing units, and hook up to necessary utilities. So I just want to point out that the ones that are here located in White Center, they don't have plumbing yet. So if that's the criteria, and this is the fastest place they could put that in, I just don't believe that. So I have an issue with that. Then here's a question. It says, what is the intent of the quarantine sites? Number one, stopping the spread of COVID-19. This isn't going to stop the spread. We clearly just saw that in Kent, and it's going to be worse over here because this isn't a hotel. People don't have their own separate rooms. They're stuck in a box. So I don't believe that. Number two, provide housing for those. A, first responders, EMTs, firefighters, people that were working with the affected. B, unstably housed people. I think that's great that we're trying to provide a place for them, but are we also trying to provide care for them, case management, mental health professionals, substance abuse counselors? Because if those things aren't provided, these people are not going to be able to stay in these facilities. They are going to, it's going to be an issue. C, people traveling into King County and from out of state, out of the country. D, people affected that live with vulnerable family members that can be isolated. And C, college students living in dorm housing. Okay. Well, that's quite a big group of different kinds of folks. And some of those folks, like I said, probably require more care than just shoving them in a box with no medical staff. All of these people do if they're sick, or, it's unorganized. So I have issues with all of that. The resources. It says King County Council allocated $1 million for outreach to A, language access, B, outreach and education, C, grants to impacted communities and community-based organizations. That's great. but I don't know if anyone's seen any of this money yet. And this needs to be acted pretty quickly on. My building alone, there's a lot of languages spoke here. And I've just talked to a gentleman today that had no idea this was going in across the street from him. He's an Uber driver. He didn't know. If this information isn't provided to this entire community, how can we keep it from spreading? So that's great that they want to give us all this stuff, but when? Now. They need to do it now. 2, the Seattle Foundation Partnership, $6.2 million. It says, A, the King County Pandemic Community Advisory Board will advise on how the funds should be allocated. Another thing, act now. This has to be addressed right now. We don't have time. So that's great, but when? And when is this happening? Then it says B, priority populations are gig workers, folks without access to sick days and or health insurance, communities with language access needs, communities of color, among others. Well, come to White Center. Hurry up. All right, now here's my favorite part. It's the FAQ that's in this letter. This is laughable. All right, so the first question is, how will isolation or quarantine sites be selected? It says A, this is the answer. Sites are selected based on unique criteria issued by the Public Health Department. Our office is still working with public health to understand the full breadth of criteria. For example, see above. So they said unique criteria. What in the hell is unique criteria? My thoughts would be, that should be criteria, a location that's in a less populated area with access to medical staff as well as medical supplies, not in a box in a residential neighborhood. So that unique criteria hasn't been explained of what that actually is, and I'm a little concerned. The next question is, will there be medical personnel on site? The answer. At this time, public health does not have the capacity to place medical staff on site. That may change as more capacity gets built with the arrival of expanded funding from the federal and state government. And the county is exploring how to get medical staff on site at this time. Each occupant will be monitored at least twice daily. My public health staff, regarding how their symptoms and presenting, will also assess if they need acute medical care. Twice a day. You're going to put sick people in a box and check on them twice a day. No, not acceptable. Okay. Question. What is the plan to transport people at the isolation site if they require hospitalization or to be moved from the site? Who will be used to transport? The EMS, the fire department? The answer says King County is working to identify local vendors and agencies to coordinate transportation. At this time, we do not plan on asking EMS and fire departments to take on this burden. Okay, so great. So someone in there is sick and they're requiring immediate medical attention. The EMS and the fire department is not going to be used. So who's going to be used? Who does that burden fall on? That is completely insane to me. And to me, that sounds like no one's going to pick them up and they're going to die. All right, the next question. Was there an equity analysis implemented when making the decision to choose White Center as a site? Okay, here we go. The answer. When a public health agency deals with a pandemic outbreak, it must act urgently in order to slow the spread of illness and prevent people from getting sick in the first place. Part of acting urgently in this case means utilizing move-in ready resources available in real time. I just want to say to that, it's not in the letter, but my answer to that, this isn't move-in ready. There's no plumbing. So that is false as far as this site is concerned. Going on with their answer. That means using land the county already owns or properties that are equipped to meet the unique needs of pandemic isolation. Though there was not time to engage the community's feedback or implement an equity analysis before securing these locations, we are committed to working closely within each community in coming weeks to ensure safety for the surrounding areas before, as, after our first patients move in. So that's their answer. No. The answer is no. The equity analysis wasn't implemented. And they said they're committed to working closely within our community. I haven't seen anybody here. I haven't heard anything as far as besides this letter that's not answering any of our questions. And my neighbors, some of them don't even know. How are we supposed to prepare for something we don't even know about? All right. The next question. Is there a way to keep people in the community updated to address concerns and fears? Answer. Public Health of Seattle King County has committed to hosting a community partner conference call on Mondays at 4 p.m. I believe they had over 200 participants on last Monday's call. However, based on recent calls with White Center stakeholders, we would like to set up a call specifically for communications regarding isolation and quarantine facilities for communities and businesses to get briefed on the latest information and questions specifically related to the facilities. We are working on determining when this call would take place. We are also planning to send out a weekly email brief and are working to figure out timing and logistics there as well, given how stretched our staff and public health are. Exact timing for the weekly call and weekly email brief are to be determined. Additionally, members of the executive office team are available to field questions and work with public health and facilities management staff to get answers. Well, how are they going to get all these people's email addresses and address this entire neighborhood? And when is this going to happen? These are such vague answers. They're not setting up. They're not setting this up to succeed at all. And I'm extremely concerned and freaked out. The next question: will the decision to isolate and quarantine individuals at the site be based on exposure or active illness? Their answer is both. So basically that means to me they're going to put people that have already tested positive and folks that haven't but have been exposed to someone that has together. There's no medical staff. They are going to check on them twice a day. Does that seem reasonable to you? Because it doesn't to me. How are they going to prevent the infected from not infecting the ones that maybe aren't infected? I don't know. Ridiculous. I think there should be maybe quarantine sites that are set up for these individuals separately at separate sites. Maybe that would have been a better thought out plan. Having sites that are just for those exposed that haven't tested positive yet and those that are definitely tested positive, maybe keeping those separate to decrease the spread. I don't know. Next question. What measures will be taken to minimize exposure to nearby apartments? That's me. To COVID-19 if it is spread through the air. How will air ventilation system be prevented from venting and dispersing droplets? Answer. Each unit has its own self-contained HVAC system so that no droplets can enter other rooms in the facility or outside the facility whatsoever. Okay, if that's the case, then why is there a giant tarp over the water tank behind it? Number one, that's my question. Number two, we just saw in Kent today that someone left and went into a business and then rode a bus. So I don't find that to be a good answer, or even, I don't know. All right, next question. How long will people placed in isolation and quarantine be at the site? Their answer. Individuals will be housed at the site until they are well. If anyone housed at the site needs medical attention, they will be transported to a hospital that can attend to acute health needs. Great. So how are we going to tell they're well with no medical staff and check in on them twice a day? I don't know. Maybe they'll die. And then it says they'll be transported, but we don't even know how they're going to be transported. What are you going to put them in an Uber and put everyone else at risk? Come on. Ridiculous. Next question. Will they be tested while they are there, and how often? Their answer. The county is working to determine the frequency of testing as more expanded testing comes online. What? Is that an answer? No, not an answer. Not an answer at all. Insufficient. Ridiculous. All right, next question. How long does it typically take to recover? Their answer. Because COVID-19 is a new virus, that information is not known at this time. Great. The next question, can there be 24-hour medical staff on the site? The answer, at this time, public health does not have the capacity to place medical staff on site. That could change as more capacity gets built with the arrival of expanded funding from the federal and state government. Each occupant will be monitored at least twice daily by public health staff regarding how their symptoms are presenting. Will also assess if they need acute medical care. That's redundant. I think they said that before. Not sufficient to me. Seems unorganized and not okay for the people on the site or the people around the site or anyone in the community, to be honest, and anywhere. Question, can there be greater security at the site? Answer, we are committed to assessing the security needs of each site on an ongoing basis. So basically Kent was a test run and now they're going to need more. I hope they're able to find somebody who really even wants to do that. Question, can funding be used to set up a community clinic in White Center that can offer testing? Answer, right now public health staff are working around the clock and are at capacity, but we are assessing this feedback. No answer. Question, why was White Center chosen if there are no nearby medical facilities or hospitals? Answer, as mentioned, the Top Hat site was chosen because it fits, well, they made a typo here, because the unique criteria for pandemic isolation. I think they meant to say it fits the unique criteria that we don't even know what unique criteria means. Right now, it looks like there's 2 modulars that can host 4 people each with no HVAC setup yet, with no plumbing setup. So if that meets the unique criteria, I'd love to hear more about what this unique criteria is. Next question, how will food delivered be handled to avoid contact with isolated individuals? Their answer, food delivery will be strictly drop and go, meaning no person-to-person contact whatsoever. County staff is working with many food delivery organizations to train them on how to execute this method. This seems kind of reasonable to me, but I think it's the only answer out of this whole thing that, seems a little bit thought out, which is ridiculous. All right, the next question, can there be a hotline for community to call and ask questions? Answer, there's a Washington State novel coronavirus call center that residents can call with their questions about King County and Washington State's response to the outbreak. The number for this call center is 1-800-525-0127. Additionally, if you are in King County and believe you are exposed to confirmed case of COVID-19, or if you're a healthcare provider with questions about COVID-19, contact our novel coronavirus call center, 206-477-3977. Great. So my understanding, what I've heard from other folks who've tried to call these, is you can't get through and they just keep putting you on, they tell you to call your doctor and then your doctor tells you to call somewhere else. And I've read several stories of people calling these and not getting any information or any questions answered or any testing done. So I'm glad they provided another bit of useless information. The next question, can there be translation services of information relating to site in Spanish, Somali, and other languages spoken by the community? Answer, in addition to the $50,000 request for language access service, funds in the Executive's Emergency Appropriation Ordinance, Public Health has a number of in-language resources available on their COVID-19 homepage. Great. I hope that this letter, as well as any other information, is updated there, as well as maybe some posters or something that gives out this homepage so people know how to access it. If they had something like that, I myself would be willing to distribute it around my building and my community, but I haven't seen anything. So that's an update on their great frequently asked questions that haven't really been answered. I'm going to update this more as I find out more information. I hope you guys are all sharing and subscribing this. And, if you have questions, I can answer as many as I can, but it looks like I don't really have a lot of answers in this 4-page document. All right. Hope everyone's staying safe.